Hello, my name is Nicola Miller and I'm going to give a short presentation on the roles and responsibilities of the midwife. I will begin by discussing the recent changes and their impact on the roles and responsibilities of the midwife, and then discuss the following: the impact of the midwife in meeting the physical, social and psychological needs of a woman and her family, as well as the role of the Nursing and Midwifery Council in relation to midwifery practice. I will then analyse the implications of the code on midwifery practice and the role of a midwife, as well as an explanation for the need for effective communication in a multidisciplinary healthcare setting. Finally, I'll evaluate the effectiveness of the multidisciplinary approach in a healthcare setting. Recent changes and their impacts on the role and responsibilities of a midwife. Before the creation of the NHS, women often gave birth at home without the help of professionals. Naturally, this meant a higher rate of mortality for both mothers and their babies. The NHS has allowed mothers to give birth with the knowledge of being in safe hands with their midwives and other professionals on hand if needed. As knowledge about pregnancy and childbirth have grown, the role of the midwife has expanded, often now beginning to work with mothers from the moment they are trying to conceive, throughout their pregnancy, and often well into the postnatal period. The skills they had to develop alongside this, and now they are expected to have a much wider knowledge including contraception, premature births, and even congenital abnormalities. Today, the fundamental role of the midwife is to support a pregnant person during the birth, including the time before and after. Every person is different, and a midwife needs to be flexible in her approach and ensure the support is personalised. This is called person-centred care. And this ensures each woman has safe, effective and a positive experience during her pregnancy and birth. In 2016, there was a national maternity review that was known as Better Births and consisted of a 5-year plan. This was designed to better the care received by midwives and the 7 main areas to review. Better postnatal and perinatal mental health care. Community and specialist mental health service means women can see their midwife as much as they need. There are also health visitors and a follow-up care from their GP at 6 weeks postpartum. Personalised care. The care of the woman should be tailored to each individual's circumstances. Women should be able to make their own decisions of how and where they want to give birth and the support they receive during their prenatal, interpartum and postpartum periods from their providers. They have the right to follow their own wishes if the baby isn't in danger. Continuity of carer. This means that the woman has the opportunity to build a relationship with her chosen midwife and other professionals. There is usually a small team of 4 to 6 community-based midwives who will all be familiar with the particular pregnant woman so they can provide continuity of care throughout pregnancy, birth and postpartum. Boundaries being worked across. Professionals working together as a team ensures women get to make their own decisions and have choices of specialist care if required. This improves outcomes and reduces health issues such as increasing life expectancy and lowering the chances of mental health illnesses. Multi-professional working. Professionals working effectively together, respecting and understanding each other, helps break down any barriers in communication, meaning a better level of care is provided to mother and baby. Safer care. Professionals working together will ensure the correct care is given and at the right time, reducing mistakes being made. There is a board in place monitoring any worrying information to try and improve the quality of the maternity services. Safer care also means data is updated regularly, meaning it reflects the patient care and performance, allowing for better analysis and improvement. Fair pay system. This ensures midwives should be fairly paid for all the extra high quality work they provide to women. In 2017, Saving Babies' Lives was implemented to try and tackle the infant mortality rate in the UK. There are 4 evidence-based aspects. Reducing smoking in pregnancy. Smoking in pregnancy increases the chance of a stillborn, as well as an early birth, low birth weight, and sudden infant death syndrome. A midwife can carry out a carbon monoxide test on the pregnant mother so that help can be provided to stop or reduce the smoking during her pregnancy. Reduced fetal movement awareness. An information leaflet is given to all pregnant women by their 24 weeks of pregnancy to spread awareness of the importance of reduced movements and what to do if they experience this during their pregnancy. A midwife will then act accordingly. Monitor fetal movement during labour. All high-risk babies during labour are monitored using a CTG. This is to monitor the baby and lower the risk of brain injury such as cerebral palsy or even stillbirth. Fetal growth restriction, FGR. FGR is a condition where the baby is smaller than expected or the baby's growth stops in pregnancy. FGR is the leading cause of stillbirths in the UK. An expectant mother will be assessed to see if she has a high or low risk for FGR. If high risk, her baby's growth will be monitored and plotted on a chart to monitor the baby's growth and risk of stillbirth is minimised. Since the launch of Better Birth and Saving Birth Babies' Lives, the NHS has generated 44 local maternity systems across the UK, improving the care provided in these local areas. The impact of the midwife in meeting physical, social and psychological needs of a woman and her family. Physical. The main duty of a midwife is to meet the various needs of a pregnant woman and her family, and there are various opportunities throughout the process in which these needs can be discussed, evaluated and met. According to the Nursing and Midwifery Council, midwives respect and enable the human rights of women and children, and their priority is to ensure their care always focuses on the needs, views, preferences and decisions of the woman and the needs of the newborn infant. There are various risks associated with different age groups during pregnancy, and this is something the midwife must assess at the booking appointment, which usually takes place at around 10 weeks. The expectant mother will be asked questions about her general health, including her weight. This is then used to calculate her BMI. If the mother has a high BMI, this could result in her being classed as a high risk during her pregnancy. BMI is also used to assess if the woman is at risk of high blood pressure, blood clots and preeclampsia. The midwife will also cover any current medical history on both the paternal and maternal sides that may affect the pregnancy, such as epilepsy, heart disease and diabetes. These conditions can then be monitored more closely during the pregnancy to keep mother and baby safe. If the woman has been pregnant before, the midwife will also ask about her previous pregnancies to see if there's any history of stillbirths, caesareans, gestational diabetes or preeclampsia, as these can also impact on this pregnancy. The family history will also be implored to see if there's any risk of genetic conditions such as sickle cell disease or cystic fibrosis. If there is a high chance of these conditions, the family can then opt for testing and counselling before deciding if to continue with the pregnancy. Midwives also play a large part on the mother's physical needs during her interpartum care. The midwife will provide advice on pain relief, her wishes during labour and how she wishes to give birth. She will also consider any religious beliefs and will also give advice on the options available to her for giving birth, such as home births and birthing centres. It's important that the midwife stays impartial on these options whilst ensuring the mother and baby are healthy. A midwife will also ensure that the physical needs of the mother are being met after the baby has been born. This can include offering advice on breastfeeding, pain relief and perineal care. The mother will also receive at-home care once the baby is home. Midwives will ensure the new mother is meeting both her own and the baby's physical needs. She will be questioned on her sleeping patterns, eating and her moods. By doing this, it can often flag up any postnatal issues, such as postnatal depression, which the midwife can then offer support and referrals in order to help the new mother adjust. Once the midwife is happy both mother and baby are doing well, she will sign them over to the local healthcare team. Physiological. Pregnancy can often trigger many emotions in women, and her psychological needs are just as important as her physical needs. This begins from the very first appointment with the midwife, where she'll be welcomed and needs to feel secure in order to discuss any issues she may have. The midwife will also encourage the pregnant woman to make a birthing plan. This can be useful at making decisions about how and where she would like to have the labour, birth and aftercare. The midwife can also give advice on the available options such as pain relief, such as gas and air, or epidural, and can explain the pros and cons of each method. Having a birth plan means the midwives will know what the pregnant woman wishes without any communication breakdowns. The midwife will also explain the process of labour, going through each stage and explaining the signs, giving the pregnant woman confidence in what to expect and ease their anxiety. Social needs. A midwife can meet the social needs of a pregnant woman and her family by giving advice on the local antenatal classes that are available. These classes are there to give information, support, as well as preparing for labour. This can also include breathing exercises, pain relief methods, advice on breastfeeding, and general care for a newborn, such as clothing, bathing, and changing nappies. A pregnant woman can also meet other women who are in similar points in their pregnancy and share their advice and experience. A discussion of the role of the Nursing and Midwifery Council in relation to the midwifery practice. The Nursing and Midwifery Council, NMC, is a regulatory body that plays a critical role in the practice of the midwife. It is a registered charity founded in 2002 that keeps a record of nurses and midwives who are practising in the UK. The NMC is responsible for setting and maintaining standards of education, training and conduct for nurses and midwives in the UK. This includes ensuring the midwives are qualified to practice and are providing safe, effective and compassionate care to women and their families. The code and standards serve as a guide for the minimum standard of practice required and act as a consequence if the requirements are not met. Although the vast majority of midwives will exceed the standards, the code is there to ensure that every midwife will meet the minimum level required to provide the standard of care needed to ensure safety and competence to the public. The NMC has three major roles in relation to midwifery. Education and training. One of the key ways the NMC impacts the midwifery practice is by setting and enforcing standards for midwifery education and training. The NMC works closely with universities and other educational institutions to ensure the midwives receive the knowledge and skills they need to provide safe and effective care to mothers and their families. The NMC also sets standards for ongoing professional development of midwives, ensuring they stay up to date with the latest advances in the field and continue to provide the highest care. Conduct and performance. In addition to setting standards for education and training, the NMC is also responsible for maintaining standards of conduct and the ethics of midwives. This includes ensuring that midwives behave in a professional manner and adhere to the code of conduct that protects the interest of the mothers and their families. The NMC also investigates complaints and concerns about the practice of midwives and takes appropriate action where necessary to protect the public. Fitness to practice. A midwife must ensure they are fit to practice by keeping up to date with training and skills. If this is not adhered to, the NMC will remove the midwife from the register, either temporarily or permanently if required. Finally, the NMC plays a key role in promoting the value of midwifery and raising awareness about the importance of midwifery care. The NMC works closely with midwifery organisations and professional groups to promote the work of midwives and ensure that mothers and families have access to the care and support they need. An analysis of the implications of the code on midwifery practice and the role of the midwife. The code is a professional code of conduct published by the NMC in March 2015. This outlines ethical and professional standards of the code for midwives in the UK, and they must be followed by all times. Failure to do so can result in the midwife being removed from the register. The code provides guidance for midwives in all aspects of their practice and is a key resource for midwives in making decisions about the care they provide to women and their families. The code plays a critical role in ensuring the midwives provide safe and effective care while maintaining the highest standard of professional practice. The code is based on four main principles. Prioritising people. The code requires midwives to act with compassion and respect for the dignity of women while ensuring that the care they provide is of the highest quality. This means meeting the needs of mothers and their families and ensuring their wishes are being responded to. Each pregnant woman wants to feel treated as an individual and make their own decisions with the advice and support of their midwives. Practising effectively. Midwives are expected to continually improve their knowledge and skills and to keep up to date with the latest advances in midwifery practice. They must work effectively with their colleagues and other services if needed. They need to support each other by sharing and respecting their experience, knowledge and skills. It is also important to keep clear records, and any decisions made must be documented with clear and detailed explanations of any risk involved. Preserve safety. The code details that midwives must always, at any cost, preserve the public's safety. They must operate only within their limits of their competence, exercising their professional duty of candour and raising concerns immediately whenever they come across situations that put public or patient safety at risk. They must take necessary action to deal with concerns where appropriate. Promote professionalism. The code states that all midwives must uphold the reputation of their profession at all times. They should deal with personal commitment to the standards of the practice and behaviour set out in the code. They should be a model of integrity and leadership for others to aspire to. They should lead to trust and confidence in the professions from patients, people receiving care, and other health and care professionals in the public. Explain the need for effective communication in a multidisciplinary healthcare setting. Multidisciplinary healthcare setting is described as being a group of professionals, all who have different sets of skills, working together in order to achieve a common goal. Effective communication is a crucial aspect of any healthcare setting, particularly in a multidisciplinary setting where different healthcare professionals must work together to provide the best possible care to patients. In midwifery, effective communication is imperative given the complex and sensitive nature of pregnancy, childbirth, and the postpartum period. A midwife's role involves working closely with the expectant mothers, providing care and support throughout pregnancy, childbirth, and postpartum period. In order to provide the best possible care, midwives must collaborate with a variety of healthcare professionals, including obstetricians, paediatricians, and surgeons, amongst many others. Effective communication is key in ensuring that all members of the healthcare team are on the same page, working towards a common goal and providing the best possible care to mothers and babies. Effective communication in a multidisciplinary healthcare setting involves key several elements, including clear and concise language, active listening, and the ability to share information effectively. Midwives must be able to articulate their observations, assessments, and plans in a manner that is easily understood by other healthcare professionals, and must be able to listen to the opinions and concerns of other members of the healthcare team and work together to make informed decisions. The midwife must be open and honest in their communication with any other healthcare professional, sharing relevant information that may impact on the care of their patients. They must be proactive in seeking information from other members of the healthcare team, ensuring that they have all the information they need to make informed decisions of the care of their patients. Finally, effective communication in a multidisciplinary healthcare setting requires trust and respect. Midwives must build and maintain positive relationships with other healthcare professionals and be respectful of their perspectives and opinions. They must be willing to trust the expertise of the other members of the healthcare team, working together to provide the best possible care for their patients. In conclusion, effective communication is a crucial aspect of midwifery practice, particularly in multidisciplinary healthcare setting. By effectively communicating with other healthcare professionals, midwives can ensure that all members of the healthcare team are working towards a common goal and providing the best care to mother and babies. An evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. The use of multidisciplinary healthcare teams has been increasingly embraced in recent years. The effectiveness is often evaluated in order to determine the benefits and limitations. This approach involves the collaboration and coordination of multiple healthcare professionals, each with their own unique skills and expertise, to provide comprehensive and high-quality care to patients. One of the key positives in the multidisciplinary approach is that it provides a more holistic and integrated approach to patient care. This can ensure that all aspects of the patient's health are considered and addressed, leading to improved outcomes and patient satisfaction. Additionally, the multidisciplinary approach can lead to better patient outcomes as it facilitates the sharing of information and expertise among healthcare professionals, allowing for development of individualised care plans and treatment strategies. However, there are some limitations. One of these is a potential for communication breakdown among healthcare professionals, which can lead to errors and decreased quality of care. In order to mitigate this, it is essential for effective communication strategies to be put in place, regularly reviewed. Additionally, the multidisciplinary approach can be resource intensive, requiring significant investment in terms of time and resources to be coordinated across the various professionals involved. Despite these limitations, the multidisciplinary approach has proven to be effective in healthcare settings, particularly in complex places where multiple healthcare professions are needed to provide the most appropriate care. The integration of different perspectives and expertise can lead to improved decision making and patient outcomes, making the multidisciplinary approach a valuable tool in midwifery practice. Overall, the multidisciplinary approach has the potential to greatly improve patient care and outcomes in a healthcare setting. However, it is important to consider the limitations and challenges that come with implementing this approach and regularly evaluate the effectiveness in order to ensure it's providing its highest level of care to the patient. Thank you for listening.